so these are two models of the spine. This is the lower back or the lumbar spine, and then this is a model of the neck, the cervical spine. I left out the model of the thoracic spine or the mid spine because the majority of problems are going to be in the low back or the neck, the cervical spine or lumbar spine. So some areas that I like to show to patients in the office visit, especially in particular the lumbar spine, I explain about the different vertebral bodies, which are these rectangular shaped blocks of bone, and these are the major support systems of the back, and in between them are the disc spaces or the intervertebral discs. They're so astutely named intervertebral because they're between the two vertebral bones. So intervertebral discs are just simply discs. The two bones will then form a joint in the back called the facet joint, F-A-C-E-T. I always want to say facet. Most people pronounce it facet. And these facet joints allow us in the low back to have flexion or bending forward and extension or bending back. Unfortunately, though, over time, these joints, like any other joint, such as the knee, ankle, the hip, the shoulder joint, can become arthritic. And with that, the joint begins to wear out at the facet area, and you can develop bone spurs in this space, in this joint. What then also happens naturally with aging is that this intervertebral discs, they begin to all wear out or decrease in height. So they begin to get smaller, and so the space between this bone and this bone becomes smaller with time. When that happens, these nerves that come out of this hole, and again this is medicine so we got to give fancy Latin words, but this is called a foramen. Simply it's a hole. So when you have the hole where the nerve comes out, that can become stiff and stenotic. Stenotic's another word for just clogging. And so if you clog off this hole, this nerve gets pinched. And why does it get pinched? Because you have arthritis of the facet joint, you have a decrease in your disc space, and you have bone spurs. And so this nerve will get pinched. And it can happen at any level, and sometimes multiple levels. Most commonly it's in the lower lumbar levels, such as L4 and L5, because that's the area of greatest stress concentration. So when these joints wear out, the disc wears out, these nerves get pinched. When those nerves get pinched, those nerves make up the sciatic nerve and go down the back of the leg, or other nerves up higher can go in the front of the thigh and down the front of the leg. So you can have different areas pinched. In the neck, the same thing occurs, where you have the facet joints, or the joints at the back of the neck, which allow bending forward, extending back, and twisting of the neck side to side. And then you have the nerves coming out of this small hole called the foramen. And again, when you get arthritis of these joints, the facet joints, when the disc wears out in the neck, which is supporting this giant structure called our head, these do wear out over time, most commonly at the cervical vertebrae 5 level and cervical vertebrae number 6 level. There's 7 bones in the neck, and we simply label them with the number that they are from the skull down. But when these discs wear out, you can get pinching of these nerves, and it can be multiple levels. When I get most concerned is when you get pinching of the spinal cord. These are the spinal nerves. There's a difference because these nerves are like branches off of the spinal cord, which comes down from the brain and is in the center of the canal in this area. When you get spinal cord pinching, you get problems such as balance issues. You get weakness in both your arms and your legs, both upper arms and both lower legs, and that could be a serious problem if left untreated.